The Charge Syndrome Foundation Speaker Series. Priorities for New Families, presented by Dr. Susan Wiley.
First, we should always say congratulations on the birth of your baby, and sometimes that doesn't happen. So congratulations if you're a new family, new mom and dad. I think the other thing that's important in my mind is the overall goal is really for our kids to be happy and the best they can be. And so that is just, I think, a driving priority of mine.
What is most important in the early days?
So I think many children with charge after birth have a lot of medical problems, even right from the delivery room. And so it's a hard time for parents, and any parent, because there's so much emotion embedded in having a child. And I think the first and foremost is remember that they are still a beautiful child and that we want you to be able to bond and connect with them as best they can, even in spite of all these medical things that are happening.
How can new parents balance medical demands while nurturing and bonding with their child?
It can be really hard to figure out how to bond, connect, and build communication in children with charge early on. And again, in part because of all the medical things going on. But really, that connection and touch and the usual parenting things are really important. And communication is going to be the bridge to so many things down the road. It's really easy to think about oxygen and heart stuff and feeding tubes, but trying to kind of find those moments in the day to connect and communicate is really important.
Who can new parents reach out to?
So when early on, if you know your child has charge syndrome, the Charge Foundation and other family support organizations are great places to learn a little bit more, kind of understand from a family perspective where to even start and where to go. It can be a little scary to meet other families when you're not quite sure what the future holds, but families do know your journey better than anyone else. Families will bring such a better understanding and I think the family connection really gives you the information from a very different perspective than all these medical people talking to you. The early intervention services are something that all states have and can provide people with expertise in vision, hearing, medical complexities, and development to help support your child. So a lot of times when you understand that your child has charge, there's a lot of things going on, and trying to find the right resources and network and information is really important.
What other community supports can parents seek?
So when we think about other community supports that families can seek, every state has a deafblind project. And while that sounds really kind of scary at first, these are folks who understand children with charge syndrome and children with multiple sensory difficulties. And so even if a child does not have full vision or hearing problems, these are folks who really understand how to make meaningful play, help your teachers and early intervention providers support kids, and can be a really great resource for information. Sometimes you can start just at the local level with social workers in the hospital or other family networks that may be available.
How can parents communicate with their baby with charge?
It's really easy to get caught up in all the medical appointments and things that have to happen for children with charge. But it's also important to remember to find that connection, find those moments of bonding, build your family system, and try to find those moments where communication can happen. While we can focus a lot on breathing and feeding, a child's ability to communicate will get them so far in life, and it's really important to start even at a very foundational level. We do this with all babies by holding them and talking to them and touching them and giving them experiences. As you start to learn the cues of your child, you'll start understanding what they're processing and how they're viewing the world, and you can expand upon that, things that they like and they're motivated about, to build more communication. It doesn't really matter if it's signing or speech or behaviors or tactile. Anything that helps that bond and communication begin to form is really, really key.
How do parents find the right medical team?
So one of the things that's really important to do is build a team, and that team has medical team members, but also community team members and support. In the medical field, it can be hard to figure out how to navigate that, and maybe you have a provider who it's not a quite right fit for you, or our different specialties are not really talking or coming up with the same ideas, or sitting in the same room and talking about how to think about your child as a whole. It's okay for you to speak up and say, hey, can we have a care conference? Or if there's a provider that isn't really quite meshing with you, asking for a second opinion or a different provider's perspective.
How does a family set priorities?
Finding your priorities and kind of keeping it as simplified as you can, and know that you can always pick up priorities as you go. But I think it's pretty overwhelming to think I have to do motor and behavior and vision and hearing and communication and feeding and all of this stuff. So it's okay to kind of think about periods of time with things we're working on that then kind of build to skills and really what's most important in that kind of period of time. Oh, and that not every moment has to be therapeutic. We're really biased. So like if you see a PT, they're going to be biased for motor. If you see a speech pathologist, they're going to be biased. I have a bias too, but nobody's talking to each other. And so in that way, you can get a lot of activities to have to do without feeling like you have a roadmap to success. So sometimes when it's time to finally get to leave the NICU or the hospital, you can have a task list that's really more than a 40-hour work week, and it's really overwhelming and really it's really not doable. And so a lot of times our medical field will put a lot of things in priorities, but you as the parent of a child has to help kind of set the tone and the priorities. It's okay to say no to some things, and it might not be no forever, but no for now. And these are the 2 or 3 things that we can really focus on as a family and move forward on, and that you'll pick those other things up as you go.
For information and resources about CHARGE syndrome or to make a donation, visit chargesyndrome.org and click the links in the description below.